In previous class, we talked about asthma in detail. Okay, so today we will talk about the treatment part of asthma. Basically, asthma is mostly triggered by, already we studied that exogen things like whatever allergic things which is not uh, accepted by the immune system, which leads to asthmatic attack like breathing difficulty, cough, all the things which you can leads to asthmatic attack. Yes, उससे फोन आता आज तो बात करो. Okay, so basically first option we have that we have to exposing of those allergic irritants like smoke, dust, or the pollens, anything which is disturbing or which is activating the asthmatic attack need to be stop. Okay, this is very important for the basic guidelines or basic thing when we have to start the treatment. Okay, we have to advise the patient to stop the allergic irritators. So mostly 99% asthmatic attack are due to the irritators. Okay, already we studied pollens, dust, smoke, animal smell, grass. Some patients will have eating food allergic. Okay, so basically we have to improve the immunity. Okay, basically lungs in the electrohomeopathy. What the function of lungs in electrohomeopathy? This is very important because we study anatomically, physically, and the reason behind the asthma. Because in the electrohomeopathy, the asthma is related to lungs, and lungs are related to, they are the purifying agent of blood. Okay, purifying agent of blood. This is the thing we have to remember. Okay, so the oxygen is entering into the lungs, and through the lungs, it is reaching to the blood. From the blood, it is reaching to the cells. Okay, so this is the very important thing. So it is purifying the blood. So in the electrohomeopathy, we have three things to remember. The organs which produce the lungs, produce the blood and lymph, the organs which utilize the blood and lymph, the organs which purify the blood and lungs. Okay. So we have the lungs which purify the blood. So it means that the problem in the lungs indicate there is a purifying issue in the body. Means the disequilibrium of blood is seen in this patient. So after that, the patient will have the utilizing of blood may be difficult to the body. Okay, then it will difficult to the production of blood to the body. Okay, all these issues which leads to diseases or disequilibrium in the body. Now what we have to do? We have to improve the blood related equilibrium issues. Okay. Lungs not only purify the blood, it is also utilize the blood. And if you can see in the second angle, it not only utilize the blood, it also utilize the lymph also. Okay. So means here what happening that lungs issues are coming due to the less utilization, due to the abnormal utilization, or due to the affected blood utilization or lymph utilization, which leads to lungs having uh, lungs having uh, the asthma. Okay, so this is the thing we have to remember. So we have to treat the lungs from the perspective of purifying agent, and we have to treat the lungs from the perspective of blood utilizing organ and lymph utilizing organ. So mostly dominancy, I can see that lymph utilizing organ. You can see that in the legs we have the lymph dominancy, but it is providing nutrition or purifying agent to the blood. So you can see that it is also blood utilizing organ. Okay, so here we will approach the in three-way dimension. Okay, three-dimension treatment for lung triangle. Okay, first we will approach directly on the lungs. Second, we can approach blood utilizing organ as a, and third as a lymph utilizing organ. So basically, if you are seeing like blood purifying agent, you need to three important remedies. One is I will type here. I think one is a structural and functional remedies. So for the respiratory system, we have four important remedies: P1, P2, P3, and P4. So mostly here we will use in the asthmatic attack both P2, uh, P3, and P4. All the three can utilize. Okay. So the electricities which are very important in this, that is BE, GE, and WE. These are very important. So in the functional, we are using P2, P3, P4. In the electricities, we are using WE, GE, and BE. Third is if the this is structural, not this is the own lungs are affecting, okay, as a purifying agent of blood. Okay, and we have structural issues also. Mostly here we can use C5. Okay, and along with I think it is better. So basically, if the lungs as a purifying agent, we have to treat structurally and functionally. Structure and function. Both have to treat. Okay. So what are the we have P1, what we have? We have P1, P2 for function, P3 and P4. So we'll select in this P2, P3, P4. These are the very important. And in the electricities, we have BE, GE, WE. These are the three electricities. And structurally, we have to two things, C1 or C5. C1, C5. Okay. Because it is epithelial tissue present in the lungs. We have to select C5. And importantly, according to the structural and functional uh, disturbance of the lungs, okay, if there is a vomiting of blood, hematosis, vomiting sensation, we have to use other symptomatic remedies also, S11 or A1. Okay, if the hemoptysis or vomiting sensation is there. Okay, and mm, more morely, sometimes we need to decrease the mucus. Okay, sometimes. So what we have to do, we have to purify in agent. We have CV17, which removes the toxic substance. Okay, likewise, we have to add the remedies. Okay. Next, we have if the most structural changes affected, so we need when one also. Or if the infective or in a smell breathing, if the patient is taking breathing by foul smell is there, it means the presence of fungus or any bacteria, pathogen is presented. So we need vermin also. So likewise, we are going to treat the patient. And we have an important remedy in C group, that is which works on the throat region, that is C13 also. We forgot about that. So in this, mostly the asthmatic issue due to the purifying agent, we will treat the patient. So one protocol I will make here. Okay, what are that? That is, if the patient comes to your clinic, first we will take P3, C13, BE. One protocol is that. Second one is P4, GE or P4BE, GE or BE. Okay. And if we are using when one, okay, so we can use P2 when one BE. Okay. And in this, we are making the protocol. Okay. So, and we have to give to remove the toxic substance, we need C17 or sometimes C17YE also very helpful. Okay, or C17 YE. Okay, next, this is the simple protocol. And we are treating the respiratory system structurally, P3, P4, P2, lower respiratory system, P3. Mostly because in the children, in the women, why you are using P3? Because they are sensitive. Due to the sensitiveness, the Dr. considermatic repeat P3. So in the asthmatic also, the lungs become sensitive. So here we are adding P3 because of that. P4, because asthmatic is chronic disease. So I need to work to remove the chronicity of the asthmatic attack. So we're adding P4 here. P2, whole respiratory system, it will work. Likewise, we are making the protocol. And most thing uh, uh, in the purifying agent, we need to improve the immunity also. So we have the immunity product that is nothing but S1. It's your choice. S1 L1WE or S1 F1WE. Or sometimes you need A3, because here only as a purifying agent we are treating the patient. So you have to select the category: purifying agent, lymph agent, or blood agent. So here we're selecting purifying agent. So we need S1W. That's okay. If additionally patient have other issues like chronic constipation, you need S-LAS or 1YE. If the patient have, these are the sure shoot treatment for asthma. Okay. And secondary, any other issues like abdominal issue, okay, and they have other issues you have to treat, you have to add those remedies. Then afterwards, you can remove one remedy after the improving effect, you can see. So this is the basic treatment of asthma. If lungs are involved, sorry, if if blood related issues or blood as a blood temperamental, we have blood utilizing agent we have to treat. Blood utilizing agent, if you want to treat the lungs, then you need to add A3. Simple. We are giving nutrition and blood effect to the lungs through this. So here you can add S1A3WE, or in the another terms you can add P2A3WE. Okay, so you can add any one S1A3WE. I prefer S1A3WE personally, because P2 we are adding with the other remedies. It's good for that, but here you can add with P2A3. Only P2A3 is sufficient. No need to add WE. P2A3. We are giving blood related or nutrition related or sanguine related issues to solve as a blood utilizing agent uh, to the lungs. You can add A3. Sometimes if this hyperphasis or vomitings of blood sputum, you need to A1. So here you need to give A1. Okay. A1BE also added here. PP. P2 A1B. If there is no hemostasis or blood vomiting, you need to be P2A3 is sufficient or WE. Okay. And now is lymph utilizing agent. Now you are treating lymph lymph utilizing agent. So simple thing. Along with A3, you need to add L1 here. This is very important. L1. You need to add L1. So you need to add P2, A3, L1 or sometimes WE. So this is the perfect combination to improve the lymph because lymph is the primarily depend upon blood, not primarily. Sorry, secondary depend upon blood. Okay. So as a result, so to improve the nutritional fat in the lymph, so you're adding A3 here. P2 is the working on lungs. So P2, A3, L1. W is required because to make the equilibrium, to make the equilibrium. So we don't know so that lungs are utilizing or not. If they are utilizing, it will make the process smoothly, it will go. Okay, if they are not utilizing, it will give the more nutrition till the equilibrium level is required or reached. Likewise, you can add the this treatment and you can give the patient uh, application of ointment like P3C13 or sometimes P3BE. Okay, sometimes P3C13BE or sometimes you need P4GE or P4BE. Okay, according to the stage of the asthma. So basically, if more chronic, we need to give more remedies, not and more remedies means like you're adding all the remedies. No, no, like according to the C13, like I gave the list. So from that, you have to select C5. Here, you need to remember that more you need if you're you want to purify more, you need to add E2 also here. A2C5 N1G. C5A2N1G. It is the very good remedy to remove the purification things related issues. We can add P2C5GE, P2C5N1 GE. So I advise initially to start with this remedy. Then gradually you have to remove the remedy after improvement. Then you have to continue the remedy, 2 to 3 remedies till 3 to 6 months sometimes after improvement, like P3 C13B or P2 C13B. So functionally, lungs are improved. Now you need to give the structural remedy. Okay. So function is important, improve. That's the reason the patient doesn't have asthmatic attack. If the structure is to improve or continuously, we need to give the remedy still 3 to 6 months, sometimes more than 6 months. Okay. So I hope you understood about asthma. Any doubts, kindly ask.